The CDC came out with some statements about some antidepressants are linked to birth defects, like Prozac in particular and Paxil. To go through a pregnancy and taking any medicine, especially the first 3 months, you have to have some concern. But these particular medicines, Paxil and Prozac and other tranquilizers, are not quite as bad. They're still, you're on that risk. The first 3 months of pregnancy is where most of the birth defects are being formed. Is that correct?
Yes, it is.
We do know that some people do need medicine to get through their depression. But if you're going to have a child, forget the Prozac, forget the Paxil. If you can't heal your depression, what kind of a parent are you going to be? So you have to think this over very carefully. Everybody would like to, most people I should say, like to expand from them having a nice family structure. But if you can't cope with yourself, how are you going to cope with a child?
Oh, that's a very good point. Obviously, a woman should not be on medication when she's pregnant, especially, as you say, the first 3 months when the birth defects are most likely to occur because the embryo is developing. So basically, we have patients that come in, and we do have to have the doctors take them off their medication, and it's a struggle, but they have to do it. There's no choice but to do it.
And the other aspect of this whole thing is you've got to look at the broad spectrum. You're going to find what got you in the depression. Having the child later on, if those triggers aren't dealt with someone can sit down and point out to you, this situation could lead you to back where you started. And if you don't have all these little triggers figured out beforehand, you're going to take your time out before you have the child. Is that correct?
I agree with you. You know, I caution all my clients that when you're having difficulties, depression, anxiety, these are not times, especially if you're really new to it and you haven't developed the skills or the ability to cope with it. These are not times to make major decisions like having children.